Hello folks, welcome back to the program. We're here and right now we're going to jump into our second discussion of the day, which is very interesting, and also we need to pay a matter of the emergence of this topic where approximately 15 years ago electronic cigarettes had started making the waves coming here to Indonesia. Over time, this form of smoking gained popularity and allure even among teenagers.
Yes, in fact, some people believe that electronic cigarettes are safer and, quote, healthier than traditional ones. However, there have been several severe cases in the community due to consistent use of electronic cigarettes.
The first story comes from a content creator, Permesta Diaz, who suffered from lung inflammation. Her social media account revealed that she required specialized treatment due to the recurrent coughing spells induced by inhaling vapor from electronic cigarettes. The amalgamation of electronic cigarettes and vape has undeniably permeated the realm of young smokers, yet the ramifications are perilous.
Another story comes from Rico Thomas Dwi Ardana, a young man from Klaten, Central Java, found himself grappling with pharyngitis as a result of 7 years of relentless vaping and smoking conventional cigarettes. On his personal TikTok account, Ardana shared his story battling against a respiratory disease that caused him hospitalized 4 times in a year. And now, folks, to discuss more about the danger of electronic cigarettes, we have Professor Dr. Erlina Burhan here with us at the studio. So, good morning, Doctor.
Good morning,
Good
Prof.
morning.
Thank you for being
Thank
here
you
with
so
us.
My pleasure.
Yes. So, Prof, we want to ask to you about the danger of electronic cigarettes, which are, of course, very prevalent in us in the community right now. And according to a data gathered by the Global Youth Tobacco Survey, the use of electronic cigarettes has increased rapidly, up to 10 times in the last year. So, what do you think are the reasons behind this?
Yes, there are some reason for this rapid increasing of the use of electronic cigarette. First is the misconception and also misleading.
Yeah.
The people think that this e-cigarette, electronic cigarette or vape are safer than traditional tobacco cigarette, which is not correct. And I keep believing in that.
Yeah.
And then the misconception also of the ingredients and the impact of the e-cigarette. So that is one thing. The second is that the electronic cigarette have this flavor.
Yes.
So you know the young people, they like to have experimenting of this taste and sensation.
That's right.
They feel it's very cool.
Right, Professor.
Yeah, very cool, superb, and also the marketing, strategic marketing also I think play an important role of leading the opinion of people that normalizing and glamorizing of using of electronic cigarette, which is very sad.
Glamorizing. That is
Glamorizing.
one term.
Yeah.
Yes.
Feel like high level.
That's right.
Yeah.
Right.
Yes.
And then also the other thing is the social media. Yeah, you can see from the social media that the youngster now very proudly posting that they use electronic cigarette, vaping, and you know maybe also the peer group pressure that want to be accepted in the
amongst their groups.
Exactly.
Yeah.
So that is one thing, and also a lot of influencer also play the role of introducing the use of vaping.
There's so many factors right there, Professor.
Yeah.
Right?
I guess
I know.
It's quite similar to what happened with traditional cigarettes back in the days when it was first introduced, where there was this Marlboro man that is considered as cool, as
macho,
manly, and then everybody wants to smoke the brand because they want to be like this Marlboro man, a cowboy riding a horse, a very manly.
To imitate the figure that is right there branded by.
So there is a marketing strategy that lead to the
Which is
misconception.
a brilliant. We have to agree that it is a brilliant.
Because they want to sell.
Yes.
Yeah.
And again, with the hundreds of flavors now, when talking about
Ah,
vapors,
yeah, yeah.
hundreds of
Yes.
flavors, even the packaging is very colorful. Sometimes like when you see it, of
Very
course.
attractive.
Yes, for the
Yeah.
user, are they are attracted to it. But this misconception that I am very interested to know, Prof, because you were saying the misconception of people thinking that it's healthier if you vape rather than the norm cigarettes. Why is it not healthier? Because there are some ingredients from the regular cigarettes that is not there in the vape.
It's not healthier, it's not safer. The correct term is that less harmful.
Okay. It is less harmful than a cigarette, a regular
Exactly.
cigarette.
Because e-cigarette is still consists of nicotine, addictive agent.
That's right.
And also some of chemical ingredient as well. Even though probably the quantity is less than the traditional cigarette smoke, but still, because you think this is safer, then you end up this youngster smoke it more and more and more. And at the end of the day, probably the quantity is even the same.
Yes.
And the impact is to the health, especially respiratory health, is also the same.
I think it's even more because it's more addictive because you don't have the smell of a
Yeah.
regular smoke. Because people usually when they like to smoke but they don't like the smell. There are some people or some
But they
people
smell
like that.
good.
Wait,
Yeah.
but this one smells good, so you don't have time to like just take off of it because you can
Yeah.
do it every time.
Yeah, and it tastes good as well.
It's exactly.
And it tastes. You have different kind of flavors. We have cereals,
Yes,
chocolate,
and different nicotines. Also, there's
Yeah.
only 3%. Like the percentage of the nicotine is also very different. Someone wants to feel more of a real cigarette, you can have the higher nicotine, or you want.
You can
to
even
feel-
have a higher than
That's right.
real cigarettes.
Yes.
Even it's, but still giving the same impact. Like you mentioned before that the youngster, the teenagers from Klaten
Yeah.
are getting pharyngitis,
Yeah.
Yes.
need to be admitted to the hospital 4 times a year. That is not a good condition.
Right. So, Prof, what are the long-term effects? I mean, we've been seeing this pharyngitis on this person from Klaten, and what are the other long-term effects on especially on the respiratory health?
Okay, so all this chemical that being inhaled will have the impact of irritation first, irritation of the airway surface, and then in some condition it will develop inflammation.
Yeah.
And inflammation means that the surface of the respiratory tract is swelling. And when the swelling is very massive all the way along, so it prevents the oxygen to pass to the lung. So it destroys the tract and also will make the parenchyma of the lung have inflammation as well, what's so-called pneumonia. For in the bronchial, we call it bronchitis. In pharynx, it call it pharyngitis. So sinusitis. So all these things will happen. That's probably the acute short-term impact. But the long-term impact is that there will be a decreasing of lung function.
Oh my goodness. Okay, so if you do this continuously for years.
Yeah, so you will get this COPD, chronic obstructive lung disease. It is very hard to breathe, yeah, and then it will trigger your asthma more frequently,
Right.
yeah, and then by the end of the day, probably even though less risk than tobacco, the risk of having cancer.
Cancer. Yeah.
It's still
But yes, I
there.
said it's less, but
Yeah.
still there.
Yeah,
Exactly.
You cannot say you are not prone to cancer because you're smoking electronic cigarette because there are that chance. And anyways, we have to be also very realistic. We're putting something inside, something chemical, something human made inside of us.
Yes.
That's right. And in regards to this, though, Prof, some people actually, our colleague Sarah was mentioning this to you before we begin our discussion right now, that there are some people taking the electronic cigarette as a substitute. Maybe they want to stop smoking cigarettes, and this is a substitute way, another way towards a no cigarette life.
Okay, I like this question. Yeah. I've been meaning to say it to many people. Yeah, you are very correct. To tell you the truth, the electronic cigarette was designed initially to substitute the cigarette, but along the way it proven doesn't work, and even more dangerous because people end up using both.
Right.
Yeah.
Yeah.
They mean to quit smoking, move to vaping, but then actually they do both
Yeah.
at the end. Of
Right.
it.
So if my vape is out, I'll take my regular cigarettes because it's right there in the convenience store, right?
Right.
Prof? So easy to get that.
So even the CDC from the US say that stop saying that e-cigarette can substitute the tobacco.
Tobacco.
It is not correct, and this is not happening. We fail to prove it.
Okay. And so that already mentioned by CDC. But if someone wants to do this as their way to stop, in how terms of period they should, try the electronic cigarette, but it fails if they feel, oh man, I'm like consumed with this again, they should just let it go.
Most are fail.
Most are fail, okay.
Most are fail, but few are succeeded.
Okay.
Quit smoking, but they need some time.
Yeah.
Yeah, months or even years, because the way they do it, like decreasing the number of cigarette smoke quantity.
Yes.
Yeah, but to stop entirely, that is very
It goes back to you, right, Prof?
Yeah.
It's your willpower. Do you
yeah,
stop
exactly.
or not?
It's from here.
Yes,
Yeah.
Right. So, Prof, do you have maybe a tips for all of us who are currently hooked into electronic cigarettes and also other forms of e-cigarettes to how do we stop or how do we prevent ourselves from smoking it more?
To be addicted.
Yes.
Or,
Or we
Well,
are already.
First, you have to know that nicotine in tobacco or in electronic cigarette is addictive agent. You have to realize that. So if you want to stop, you have to stop from your heart, from your mind, and then let people know.
yes.
Let people know, let your family knows, so they can help.
Yeah.
And also, I think government should do something.
Absolutely.
There is a regulation on tobacco smoking, but there is no regulation on electronic smoking.
Yeah.
Yeah.
You know, stop smoke electronic smoke among around children or teenagers because they will follow. So please,
Yes.
parents, mom and dad, do not smoke in front of your child because they will follow. You know, the case from Klaten,
Yeah.
he has been smoking since 7.
Yes, yes.
He
because
was a child
Yes.
Yeah.
when he started smoking.
It's mirroring the parents, Prof.
Exactly, they will follow.
And I want to ask you in regards of the electronic cigarettes, because we've seen, especially right here in Indonesia, people are usually, the common form is they use the vape or the electronic cigarettes inside the room. Back in the days, usually they have a separate, if you want to go have a cigarette, you have another room or maybe outdoors. But now you can do it indoors.
That is the thing, because there is no regulation on vaping or electronic cigarette.
Yeah.
People think that they can do it any place, anywhere, because there is no regulation. They said, oh, the free zone, smoking free zone is for the tobacco or cigarette, but not for the vaping.
What about the second smoker? I mean, because
Yeah.
for cigarettes you have a second smoker, but for electronic cigarettes, is that such a term?
Yeah,
Is it dangerous for
Yes.
them to second smoke vape?
it is
vapors?
similar. As long as you're still breathing,
Okay.
you will get the same effect, even though maybe less.
Less than
Yes.
traditional cigarette.
Yeah, but if you get exposure to it in the long term, you will be the same. It will be the same
Right,
effect.
because in some countries, I know for a fact in Singapore, it's electronic cigarette is banned from the country.
Yes.
100%. It is illegal for you to bring electronic cigarettes into the country and also to use and also to sell one.
Even in UK, they said it's illegal for e-cigarette for people under 18. And here, 7 years old, starting smoke e-cigarette.
Yes.
It's
This
very
is
sad indeed.
very dangerous.
Yeah.
So it takes all parties, including the government agencies, for all to work together. for
Parents.
this prevention. Parents, definitely.
Teachers.
Regulations.
And I would like to recommend that the smoking, the impact of the smoking should be in the curriculum.
Okay.
So the student will,
It's a part of education.
yeah, it's part of education.
Yeah.
The student will know the dangers of this cigarette smoking.
Yes.
Wow.
I wish.
Well, I mean, Professor, you already put it right there in the world, and hopefully, we will hear it, and hopefully, the universe will hear it too. Professor, it was such a great
Yes.
time. Listen, I mean, we will hope that we have more time with you. Definitely, this is something. Is a topic that is just widening the spectrum. There's so many questions that we need to.
Hey,
ask
we
and
can
really
do it in
delve.
regular basis actually.
That's right.
Why
Part
not?
of education.
That's right.
You're right.
Yes.
Okay, so Prof, thank you so much for coming with us in the studio and sharing with us the dangers of electronic cigarettes. And all right, folks, we're gonna have a short break, and after the break, so we have more updates just for you. So stay tuned with us.